Welcome to another episode of the Happy Friday Committee, Happy Friday Committee Mindset. Today we have a special guest coming on, Dr. Leonard Brown, who is actually a dentist. And it's something that is very near and dear to my heart in terms of, because I have to keep my smile. So I had to ask him on here to get his perspective on the Happy Friday mindset. And I want to base that around what you do. First of all, welcome for coming.
Thank you, Jason. Thanks for having me on the program, podcast. I appreciate it.
Thank you, sir. Thank you. But I want to base this around what you do in dentistry. And, because people got to keep their smile. So as far as just having that, first I want to start off just by asking you, as far as being fearless coming into the dentist office.
Welcome into the office? Yeah.
As far as, for instance, when individuals come into the dentist office and they want to, and they're actually scared.
Yeah.
They have a fear of visiting the dentist.
Sure.
Why is that? And what can they do to overcome that?
I would say a lot of patients, or the ones that have an extreme fear, they kind of developed it at a very young age, maybe a bad experience that they had as a child going to the dentist. I hear various horror stories like, I was in the chair and, I wasn't numb and like they kept drilling and I was screaming. My parents were out in the waiting room. Nobody was to help me. So a lot of that is from, I guess a little PTSD from a child going to the dentist. And then other horror stories that, that they have in their mind, from people telling them various things, or sometimes they look up procedures on the internet and they get maybe a wrong sense of like what it is we actually do. I try to be understanding when they come in, try to find out where the fear is coming from. Try to empathize and help alleviate some of their concerns, just try to tell them, hey, I'm patient, I'm not going to tie you down. I'm not going to be standing on your chest, doing whatever I need to do. So just really try to reassure the patient, right? So as to hope, to take some of that fear away.
Excellent. Yeah. The next principle, and I'm sorry, I did not go through the principles, which is being fearless, resilient, intuitive, determined, appreciative, and youthful. The next principle would be resilient. And I want to put that in the context of someone coming in and they have a lot of issues with their smile, and how can they get that fixed?
Well, resiliency, is really the ability to bounce back from, adversity or setback. A lot of patients, especially in my particular field of dentistry, they do have a lot of dental issues, right? Most of them are kind of at the end of their dental rope, right? I do a lot of surgeries, removing the rest of a patient's dentition or whatnot, giving them implant supported denture. So it's really just, kind of just getting over what they may have experienced in the past. Let them know, hey, we're going to move forward. We're going to get you back to where you need to be. A lot of them have confidence issues, right? They've been, had a really bad smile or had a lot of dental pain for a long time. But just letting them know, hey, I'm not here to judge you. I'm just here to help you out, try to get you past, some of that anxiety, some of that fear, some of that, shame that some people have for having a bad smile, and just kind of try to motivate them to stay on the road, to see the process through or whatnot.
Excellent. The next principle is being intuitive. And in terms of going with their gut initially, when you initially have a feeling that something is wrong,
sure,
what should you do?
As far as the patient, or
yes,
well, Are you saying like if a patient is kind of yeah, so that's an interesting question. So intuition or intuitive, I'm looking for context clues, like what is really motivating this patient. Sometimes they'll come in, they'll say little things, or they'll say, they'll lead off with like, my last dentist messed me up, or no dentist before that they went to did them right, and the reason why they're in the situation that they're in is because it was dentist's fault or whatnot.
Yes, sir.
And so, or they might say, hey, the last guy sued him, da 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 da. So I'm trying to find out what your angle is. I'm listening to all them clues, trying to determine, hey, is this person being genuine, or are they really looking to kind of take advantage of a situation. So I have to listen to everything that they're telling me and use wisdom to kind of draw a proper conclusion of what the patient's true motivations are.
Excellent, excellent. The next principle is being determined. Okay. How can, in the context of getting my everything taken care of in my mouth, if something is wrong, how do I stay determined? And it looks like nothing is that's happening is working. Mm-hmm. How do I fix that? How do I stay determined?
Well, one of the benefits of dentistry, most times there's more ways to approach an issue, right? So we can review what may have gone awry, or maybe didn't go the way that the patient expected it with their previous visits at various practices, or even at my practice, right? And just really try to assure them, hey, we have multiple treatment modalities to help you out. If you tried a denture before and you could never get it in, get it to stay, hey, we have implants, right? So there's multiple ways to approach getting the patient through their treatment needs, whether it be financing, whether it be just a particular type of treatment, right? So just try to keep the patient engaged, right? After they leave, we give them a treatment plan. We want to call them back after a few days, like, hey, what did you think about what we went over? We appreciate you coming in. We would love to see you again and get you through the process, to help them stay determined to get to that end goal that they need to get to.
Excellent, excellent. The next principle is being appreciative. Right. How, in the context of the patients that you've seen, mm-hmm. that actually went through the whole process of getting whatever they needed fixed, what was the final outcome? How did they show appreciation? How did they look? How did their the before and after picture?
Yeah. Appreciation, it's like a two-way street, right? So I have patients, they come in, they crying at the end. They're like, can I just hug your neck? I have, most patients are very appreciative of, either getting them out of pain, improving their smile, giving them their confidence back, right? So most patients are very appreciative of that. And then likewise, hey, I got to show you, appreciation that you came and decided to be a patient of mine, right? I work and I strive to show appreciation to the team that helped me carry out the procedures. So it's a two-way street. I want to definitely show appreciation to my patients, and they, most of them are very gracious and they show me appreciation as well. So that's really at the end of the day, it's all about being thankful. Thankful for people Absolutely. Who help you out, and they're thankful when I help them out with their pain or their confidence, or just getting their smile back and their function back. So.
Absolutely. Mm-hmm. And the last principle would be youthful. And you mentioned the word confidence.
Mm-hmm.
How does that give the patient confidence and make them more youthful after it's all said and done?
Yeah. So, like I said, people come in, they may not have any teeth, or their teeth might just be all decayed at the roots or whatever. And of course, like if a patient's missing all their teeth, naturally they're gonna have an older appearance, right?
Yes, sir.
So we want to get them back where we build up that facial structure, right, where they're not looking super old, and it helps them with their confidence. And as far as youthful as well, I try to stay youthful in my practice and my dealings by learning new things, right? We want to learn from the things that didn't go quite as well, and we want to build upon the things that did go well and try new techniques and new approaches, right? So that's how I try to keep the practice youthful, and dealing with my patients and even with my staff, doing new things, right? Keep everything fresh and youthful. So
excellent. The last and final question out of all these principles, being fearless, resilient, intuitive, determined, appreciative, and youthful, which principle sticks out to you the most and why?
I would definitely say appreciative, right? I mean, like I said, with appreciation, I definitely want to always be thankful for people when they patronize me. Not just that, thankful for my relationships, thankful for everybody who's kind of poured into me or giving me opportunities, right? So, I think appreciative is probably the concept that sticks out to me the most, right? Because, we can be fearless, we can be resilient, right? But at the end of the day, if you're not thankful for the opportunities that you're given, I mean, you're just going to be probably a horrible human being at the end of the day, right?
Absolutely.
So I think appreciative is probably the most honorable aspect out of all those characteristics that you put forth.
Absolutely.
Yep.
And I'm appreciative for you doing this interview.
I'm appreciative of you having me.
And taking time out of your busy schedule. You just finished golfing?
Nah, not today. Yeah, no. No, we took my oldest daughter to school. She's starting at North Carolina A&T.
Okay.
So
congratulations on that.
Thank you. It's been an interesting, weekend or whatnot. Your firstborn out the house is kind of like, wow, just kind of run up on you, and all of a sudden, like they're gone. So so it's been a good weekend. So
excellent. Well, thank you for coming on, and thank you for doing this. And we will talk offline. But thank you.
Thank you for having me. I appreciate it. Thank you.
All right. You have an excellent day.
Okay, you too. Bye.